The following portion of Living Local Carolina is sponsored by Strand Dentistry. Well, welcome to Living Local Carolina, everyone. Today I'm at Strand Dentistry and I'm joined by Dr. Swensen. Thanks for chatting with me today.
Yes, happy to have you here.
I'm happy to be here and learn more about you guys and what you're all about. There's a long list of things that y'all offer, but why don't you tell me a little bit about yourself and about the practice?
Well, personally, I just moved here from Arizona, and the practice is just based on working in technology, keeping up on current practices, and honestly saving time for the patients. Mm-hmm. Time is a big deal. I mean, most of the time when you go get something done, it's like you're going to be, rerouted, rescheduled. We really try to work everything to where we can do everything on the same day as much as possible. Quick scenario, let's just say you need to get a crown. You come in, we scan it in, we mill out the crown, we cement it on, you go home, you're done. You're not here for 2 appointments. Yeah. We try to get that all done within 2 hours. Sometimes we can get it done quicker. Sometimes it takes a little longer. Humans are different. Yeah. Each one of them is individual, and they present individual challenges. From there, we've actually gone to, what can we do to some of the patients that have different prosthetics, say like dentures. And we've got it into 3D printing to where we could 3D print the dentures.
Wow.
And so we can do that. We could do it in a day, but it would take the whole day. So we just generally try to schedule it, a couple days later, but we can get it done fairly quickly. And the accuracy and the things that we can do is much better because we're able to use 3D technology to line everything up and also just create a better fit.
Yeah.
And, there's still discrepancies with each individual, but it does a much better job than we were able to do before. From there, we've gone to different CAD/CAM techniques for different milling units and bigger prosthetics and things like that. That just gets really technical. So
I was going to say, the viewers may not know all these terms that you're saying.
No. And probably another thing is like, it's hard to get extractions around here. Dr. Armstrong and myself, we're old. We started out doing extractions, and that's what we do. Okay. We do a lot of extractions. So even sometimes if you don't want to be awake, we can schedule an anesthesiologist to come here and get your extraction done.
Gotcha.
If you're into that kind of thing.
Well, let's say there's a scenario where unfortunately somebody loses a tooth.
Right.
You guys can do implants here as well.
Correct.
Tell me all about that.
Implants, it's kind of fun because like I said earlier, I'm older than dirt. So back in the 80s, I worked in a dental lab, and that's when honestly the implants started showing up. So we'd get these implants to come in. We'd have to create these prosthetics for them. And that's when I really got interested in it. And I was probably about 16 at the time.
Wow.
So from there, I picked a dental school that allowed the general dentist to place implants at that school, Creighton University, at that time. And then from there, I've just learned more and more and more and more as time goes on. And there's just so many applications for implants. I mean, most people are aware of what they can do, and it's really exciting.
Well, how does it feel whenever you have a patient that comes in and they, were experiencing pain or they lost a tooth and you guys were able to give them their smile back?
Well, let's back that up. First thing, they're coming in pain. So the first thing we want to do is get them out of pain.
Yeah.
Okay, that's the first thing. It's like people come to the dentist and a lot of times they're not in good shape.
Yeah.
So, we'd get them out of pain, get rid of the infections, and then go on to the restorative part. Give them their smile back. So many people are walking around with bad smiles and they don't like it. It's self-conscious. I mean, they just, they don't know it, but everybody looks at your teeth.
It's true.
And they don't know they do it, but everybody does it. But we're able to do that, and a lot of people, some people, you give them their restoration and they cry, but that's exciting, and that's nice as well.
All right. Well, I appreciate you chatting with me, letting me know a little bit more about Strand Dentistry. So if one of our viewers is watching right now and they want to learn a little bit more about you guys, where can they find you online?
GrandStrandDentistry.com.
This portion of Living Local Carolina was sponsored by Strand Dentistry.